how to not be determined or destined to wear pad, brief, depends, always discreet, whatever they're calling them. Being the lady in the commercial that's just enjoying life with her briefs on as if it's normal. And it's not normal, not at all. So, how to not be destined or doomed to wear pads or briefs. So, before that, let's talk about what's normal and what's not normal when it comes to urine. You're being able to go to the bathroom, or what happens when you're having signs of urinary incontinence. So back to what's normal, what's and not normal. So when it comes to your bladder, typically your first desire to be able, or that says that, hey, I have to go to the bathroom, is when your bladder is probably about a third or so filled. So your capacity of your bladder is typically about 400 to 600 milliliters. You get that first desire, like urge, like I have to go, probably between 150 to 200 milliliters of when your bladder is full. It takes about 3 hours for your bladder to fill. So sometimes we have people that are have gotten to the habit of going to the bathroom just in case. I'm at this place, or I'm at home, or I'm about to go on this trip, and let me just go to the bathroom just in case. That's not a good thing. Now, if you are having, or if you're a just in case person, go ahead and type that in. Go ahead and type that down into the comments, just in case, and we'll circle back to that as well. So, what's normal and what's not normal when it comes to bladder health? So, when you go to the bathroom, there should be no pushing or straining. It shouldn't be necessary that you kind of have to force yourself or feel like you're forcing out your pee or anything. Not normal. So, once again, that normal capacity of the bladder, 400 to 600 milliliters of fluid in there. You get the urge to go about 150 to 200 milliliters of bladder. You should be able to hold it. You should be able to hold it. And you should be able to wait, and you should. You don't want to get into the habit of the first time you feel that urge, you immediately go. So that's another way that we're actually training our bladder that once it gets to that first urge, we always have to go. And then that's when we get into the thing where people are going to the bathroom several times an hour. Or you're going to the bathroom a lot of times throughout the day because we're getting that sense of urgency and we go on that first time. So when it comes to a lot of the training that we do, when it comes to pelvic floor health, we look at some of those behavior patterns to see, are you going at the first sign of urge? Are there potential bladder irritants that are going on as well that's causing you to have that frequency of going to the bathroom? So normally, normal going to the bathroom, having to pee throughout the day should be between about 5 to 8 times per day. If you find yourself going to the bathroom greater than 8 times per day, that could be a sign that you have some pelvic floor dysfunction. So a lot of times people don't even realize that they have that urgency. You've actually trained yourself to say, hey, before I go into this meeting, before the 8 o'clock meeting, let me go to the bathroom just in case. And every day you train yourself at 8 o'clock or 7:55 to go to the bathroom. And then another time, I'm just at this gas station, I'll just go just in case. And those may be times where you may not even have the urge to go, you just go just in case. Or you've been having some other issues with your pelvic floor muscles and don't realize that you're actually going too many times a day. And actually that it's a problem and there's something that can be done about it. So, circle back, what's normal? No pushing or straining is necessary for you to be able to go to the bathroom. There should be something natural. You should be able to get all your urine out and you not have to strain or move a certain way to get a little jiggle and triggle out when you're going to the bathroom. So there's different types of incontinence. We're just going to talk about some common ones. One is stress incontinence. So these are type of questions that think about asking yourself. Do you lose urine when you cough, sneeze, jump, lift weights, run? Yes. Do you leak urine with exercise or with exertion? Does that leakage occur immediately when that situation is there, or is it delayed by several seconds? So sometimes people think, oh, it's just because I'm older, or just because I've had kids, or just because this and this and this and this. Yes, the frequency of having urinary incontinence or having leaking, it does increase as you get older. But it's not normal. Very common, but it's not normal. You're not doomed to it, and you don't have to just live with it. So think about the movements. With any particular activity, do you notice that, ooh, I pee a little bit, sneeze, cough, jumping impact? Sometimes if you have small children, it could just be lifting and picking your child up because that's an exertion. So that's stress incontinence. Urge incontinence is you have urine loss that occurs with a strong desire to urinate. That's like that urgency. Like, I feel the urgency, I gotta go now. If I don't go now, I'm gonna have an accident. That's urge. So that's typically within a few seconds, to minutes. That's the warning you get, like, boom, I gotta go. The bladder, that means basically with urge, your bladder contracts when you don't want it to. So it contracts, give you that urge, like pressure, like, ooh, I gotta go. And that's not a normal occurrence. There's also a combination of those two, stress and urge incontinence. You can have a combination of those together. And you can also have what's called overflow incontinence. So that's kind of like an involuntary loss of urine. And that's due to like overextension, and your bladder's kind of been stretched and pulled. So that's based on a failure for your bladder to empty well. So that means that urine kind of leaks or dribbles small amounts when the bladder overfills. So those are common things that are thing as far as types of incontinence there. So what can you do about it? So first is identifying that, yes, maybe you do have some incontinence issues that you've even adjusted or stayed away from your certain activities. So some people don't even realize that it's really an issue because they just began avoiding doing those things. Oh, it's not an issue. I just don't do that anymore. That's changing your pattern. That actually is an issue. So if you're avoiding activities, if you find yourself wearing a pad or brief, or you go and do the just in case bathroom trips, those are things that are symptoms of a pelvic floor dysfunction when it comes to how you go to the bathroom, or how our body has adjusted and maybe picked up some bad habits. So if you're doing just in case peeing, that could be something that you did after babies. That could be something that you do now prior to car trips. You go just in case. If you kind of did that semi-squat, if you have that semi-squat position hovering over the toilet, like we were taught, like, oh, when you go out in public, don't sit on that toilet. So you got to do the squat. So kind of that hovering and squatting over the toilet and not sitting all the way down, that hovering actually puts increased pressure on your pelvic floor. And that can lead to abnormal bladder habits and urinary incontinence issues. If you've been told by your doctor, only do Kegels. Let me just, the way that you do your pelvic floor muscles is you stop the flow of urine. That's a common thing that people get there. It's like, oh, I'll just stop the flow of urine. That's how I contract those muscles. And if you've gotten used to doing that, that can also increase that risk of having urinary incontinence and bladder issues. So you don't want to get in the habit of stopping the flow in urine at any time. Like when you're going to the bathroom, you don't want to get in the habit of doing that. When you're going to the bathroom, straining and not relaxing. Being dehydrated or not drinking enough, or you basically have started avoiding fluids so that you can decrease the amount of time that how many times you go to the bathroom. So if you have less hydration, that equals less uric acid in your urine. So that also can irritate and cause urgency. So the restricting of fluids, that's also a symptom of abnormal or dysfunction, kind of bad habits that we have that can have an impact on our pelvic floor and increase, if you're doing these things increasing over time, that's going to lead you to thinking, oh, I got to wear that Depends. I got to wear my pad or my brief, or I'm going to avoid this thing because we've actually built in some of those habits, and abnormal muscle contraction or not being able to relax those muscles in our pelvic floor has led us to having some pelvic floor dysfunction and issues. Those are popping in the comments. If you have questions, please drop those down in there. You can also directly message me if you're noticing any issues, or you want to be that person that's going to be proactive. Like, I know I'm getting older. I know there's things that I want to do to have the best quality of life. And now that you're aware that, hey, you just don't have to live with different pelvic floor changes as we get older, and you don't even have to have had children to have pelvic floor issues. That's another kind of common myth too. Age is a factor as we get older. Things change as well, but you don't have to live with those. That's not something that's inevitable for you. So pelvic floor. So how not to have to wear those discreet, be on the Depends commercial. Hey, she's living free and living her life. That's a common thing, but that doesn't have to be your norm. So first, we're checking behaviors. We're adjusting things in our nutrition or in our diet that may be potential irritants to our bladder. We're setting up a game plan to be able to see what a bladder diary looks like. We're also addressing pelvic floor muscles, being able to have an assessment to see, do we have things where those muscles are overactive and tight, or do we have those things where those pelvic floor muscles are weak? So a lot of times people are saying, hey, because I'm losing, I'm leaking a little bit, I must be weak. So they go and tighten. But a lot of times it's not because of tightening. It's actually because those muscles are actually the opposite. They're overactive. They're already tight. So now you're adding fuel to the fire to muscles that are already tight by continuing and trying to contract them as well. So being able to have a clear assessment of what that looks like, it be able to guide what treatment looks like for you. Just like anything is, hey, I'm having pain in my knee. I need to be able to see. I can't look up general knee exercises. How can what's exactly going on with the knee, and be able to tailor exercises for it? There's a gazillion exercises for the knee. There's also multiple exercises and things to help to train our pelvic floor muscles, and it's not just doing Kegels. All right. Until next time, make sure to, wherever you're listening or viewing this, make sure you follow me on TikTok and Instagram at Renew Her Physio for all things pelvic health, women's health, and that transition between perimenopause, menopause, and beyond. See ya.